Dr. Corral, as a podiatrist, can you describe how poorly controlled diabetes affect the feet?
Well, poorly controlled diabetics, you will always see a progression. It initially starts with diabetic peripheral sensory neuropathy, which is a decrease of sensation. They might feel a large pain or pain that's really severe, but they won't feel finite pain, such as stepping on a needle and walking on it all day. A nail could go through their boot and they don't even feel it. As the cardiologist mentioned, a lot of times they have to wear, shoes that are non-skid and steel-toe boots that are maybe a little too tight, and they'll develop blisters and calluses that then lead to wounds that they don't feel until the end of the day. Along with peripheral sensory neuropathy, you'll have peripheral arterial disease, which is bad circulation. So you may not have the proper circulation to heal a wound that you developed that you weren't even aware that you had. The other thing that you'll develop with the peripheral sensory neuropathy are foot deformities, such as your bunions and your hammertoes, as well as your sarcoarthropathy, like I mentioned, is a breakdown of the bones of the foot. If you don't treat those deformities, a lot of times you'll develop the blisters in those areas, especially when you're wearing cowboy boots, tight shoes, you're wearing your dress shoes to church. You will develop those calluses and those blisters that you may not even feel, that then develop into open wounds, and that often leads to amputations. One of the things that affects all of the doctors here at this panel that poorly controlled diabetics will have is immunopathy. Their immune system doesn't always respond to infection as quickly or as appropriately as it should. And so you throw in, they don't feel that they have an open wound. They don't have enough circulation to take, antibiotics or their own immune system to fight off the disease. And then they have all these foot deformities that keep causing the problems to return over and over.